Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have a conversation on the business side of medicine, so that you and your practice can thrive, be profitable, and successful for years to come. This week on the Edge Podcast, I welcome fellow NSCHBC member Jacki Jacox, healthcare CPA and financial consultant. With over 13 years of experience in both public and private accounting, Jacki has earned the reputation as an accomplished CPA who delivers high-quality financial and advisory service to clients in the healthcare industry. Her areas of specialization include provider compensation models and valuations, due diligence and business valuations for healthcare mergers and acquisitions, physician practice management and accounting, provider relief fund single audits, management service organization information development and enhancement, so MSOs, and also the administrative fee valuations, and other projects and analysis. Welcome to the podcast, Jacki.
Thank you, Terry. I'm so excited to be here, and thank you for having me. I look forward to talking to you today.
You bet. We're really happy to have a subject matter expert like yourself, especially because I think there's maybe a misperception or not really an understanding of what an MSO or management services organization is and how they compare to an ACO. And so we'll kind of talk about that today. Let's see. So one thing I want to get started with, maybe you can give us just kind of in a nutshell or kind of a definition. What is an MSO?
So management service organizations is a separate entity that's usually established to manage the administrative and non-clinical functions of a medical practice or even healthcare organization. And so the key to a management services organization or MSO is that it really streamlines the administrative tasks and improves the operational efficiency for healthcare practices and facilities. And I would say the big key differentiator of why an MSO for a medical practice is it can be owned by licensed providers or non-licensees. So that's really where we see the entrance of private equity or venture capital investors, even hospitals or family members of the physician owners.
Oh, wow. Okay. So, well, gosh, you brought up all kinds of questions now that I have, and I'm sure that our listeners have. So I would assume then, based on what you said, this is a company, it's a separate entity that provides non-clinical services to medical practices like, payroll and maybe, care management, financial, administrative services, right?
Yeah, so I always think of it as anything non-clinical. So that can be practice management services, revenue cycle management, human resources. Those are just a couple examples. There's IT support, accounting and financial management, marketing, then you can name it. As long as it's not healthcare service, then it can be under the MSO.
So you're not administering physical therapy or
exactly.
Okay.
Yeah, and not even in a lot of cases it depends on the state, but a lot of cases the MSO can't employ the physician. So all malpractice liability, for example, for the physicians and benefits and compensation still has to stay with the medical practice.
Well, so that brings up a question. Does the MSO, are they the ones that they have the employees to staff, notwithstanding the physicians, so obviously they have to be on their own, but do they staff the front office and back office, things like that? Or do they just manage who's in place?
So it depends on every agreement. Now the MSO can employ those non-providers. So in the cases of employee recruiting, they can hire, they can train, they can do the benefits administration, but they can truly have all the staff that they provide from the MSO versus having it on the medical practice profit and loss statement or financials.
What have you found has worked better with, and actually I'm asking this because I see a lot of practices that hire family. And so then,
Yes.
but they want to, kind of outsource, if you will, the administrative process, which I'm thinking that's what the MSO is for. And
Yep.
so, how does that work when now you're managing, family that's actually related to the providers? Is that tough?
Yeah, and I will say a lot of times when you see, it just depends on the MSO that they are looking to collaborate or have agreement with. A lot of times we see the exit of family members during that time.
Yeah, I'll bet.
So I will say that is just being honest. That's usually a nice segue
Yeah.
for family members to exit.
Well, and
Um,
it's not so our listeners know we're not saying
no, yeah,
anything against family
no,
members,
no, not at
but
all. Not at all. And actually, I will say on the latter side of that, some MSOs are formed for the sole purpose of having a practice owner be able to have their next of kin, for example, have some kind of stake in the practice. So if they have the skills from a management perspective, by all means in the healthcare realm, if they are qualified and they're doing a great job for the medical practice and they want their kids to have a stake in the practice or ownership, but they aren't a provider, and they live in a state where you have to be a provider to own it, then MSO is a great option. And that's where we see them split out the medical practice and create their own MSO. So there's that side of it too, that, in a case where a family member is doing a great job and they should stay on, that's a benefit too.
well, now does your company that you work for, and you can say it on air, who do you work for,
Yeah.
Mazars?
Mazars, yeah.
Yeah. So, are you guys an MSO offering, or do you help create MSOs for providers?
Good question. So we actually help create MSOs,
Okay.
and we help with the administrative fee valuations,
Okay.
because one of the key things about MSOs that I can't stress enough is because of the laws and regulations around them, it's imperative that they have sound healthcare lawyers involved to make sure the contracts are appropriate and in line with the laws and regulations in healthcare. But in addition to that, also making sure that their contracts are within fair market value,
Okay.
because of the very, very detailed laws that in healthcare also that make sure that there's an appropriate fair market value arrangement between the MSO and the medical practice.
So you're out of New York, correct?
Correct. So I work out of New York, and actually, funny enough, I work remotely out of New York from Nebraska.
Oh my gosh. That's kind of cool,
So,
actually. I'm like,
yeah.
where's your accent? I was waiting for you just have a New York accent. I don't hear one.
Yeah. So I get the luxury of getting to go to New York, and I love New York and New
Nice.
Jersey. I have a lot of clients there too. But I have clients all over the US, and being very centrally located, it actually is super beneficial. So
That's awesome. Well, it's
yeah.
funny because as soon as I knew we were going to be talking about this topic, I started doing some research just where I'm in California. So I'm on the opposite end of the country from where you are. And it is, like you said, it's regulated. There are
Oh
some,
yeah.
all kinds of rules. And I think California has some of the toughest. I was just like,
Mhm.
wow, so it takes somebody like yourself to
Yeah.
be able to navigate through that regulatory water, right?
Yeah. And we actually have offices in California too.
Nice.
And so we have a whole team that we work with in California with MSOs, specifically for that reason, because New York and California, I mean, there's lots of states with lots of regulations around them, but New York and California are some of the more stringent states with laws and regulations.
Probably due to population. I would think Florida probably is up
Oh,
there
yeah.
too.
Yeah, Florida has like their own kind of unique rules, as you can imagine.
I can imagine. Now, here's a question, because be just based on what we've already talked about, and you say you can create them, as a separate entity for providers as well. Does an MSO usually have more than one provider group, or are they independent to that particular provider group?
Great question. So usually I would say it depends. If it's
Okay.
a practice, a medical practice that's bifurcating their financials or splitting out their financials to create an MSO, it always starts out with just one practice usually. Um, unless they own like multiple practices already. And then from there, the idea is to the economies of scale. So then you start to bring on more contracts with more medical practices, because if you want to meet the true benefit of an MSO, you're going to want more than one practice under it because of the economies of scale. You can consolidate and really scale and improve the operational efficiency the more practices you bring in under it.
Well, and that kind of brings to a separate question, which this is what I keep thinking about, is that right now, especially with the No Surprise Act, which I'm sure you're familiar with, and some of the things that people are dealing with being in network or out of network, some doctors are just so frustrated with that they're like, well, I just need to get on a panel. Well,
Yes,
some panels are closed,
exactly.
but aren't the MSOs sometimes in a better position because of having a kind of a larger network of not only providers, but a little bit more administrative muscle there to be able to not only negotiate, but not burden the physicians with that?
Yes. So I will say owning a medical practice has become so complex.
Oh my
And
goodness.
that's really, I mean, we all know it, right? And
Yeah.
so that's really where the MSO brings a lot of value, because we always ask medical practices, what are they bringing to the table for you? I think that's the most important question when they're even considering, when they get approached by an MSO that may already be established. We always ask that question first. What's in it for that practice to have that arrangement? Because you really are giving away a lot of that control from a non-clinical administrative perspective. And so, one thing we always say is make sure that they have great contracts. For example, do they have good payer contracts? And because a lot of times that's where the efficiency is gained, because they may have a higher administrative fee than their overhead is existing, but they would then benefit from the contract negotiation perspective. So the benefits would outweigh the costs in that scenario. So one thing that we do with our practices that I call it the due diligence phase, because when a practice is approached by an MSO, it's so imperative that practice just doesn't take everything at face value, and the arrangements that they bring to them can be very complex. And so I always like to work, that's where they kind of bring us in to work with the MSO that is looking to work with them. And we get down to a very granular level on the financial statements and say, okay, let's put together a historical hypothetical analysis, is what I call it. And we look down to expense line item, whether that MSO would cover it or not. Okay. And you would be shocked at how many things that the practice would have thought would have been covered going forward, but actually isn't. And so that's where I think it's just doing that due diligence up front and really understanding what's going to be covered, what's not going to be covered, what benefits are they bringing me. That's the big important question, because we work with practices all the time that, because of that due diligence phase, they're able to go back and say, well, since you're not covering this, or my comp isn't going to look as good, then you need to, be flexible on your fee. So there's that type of stuff to think about.
Well, it's funny because I'm a coder, biller, reimbursement, auditor, so I'm not in your space. And I stay in my lane, and I get a lot of my clients going, can you just please do an evaluation of my practice? I'm like, no. Can you do an evaluation of this or that? And I'm just like, so now I know my go-to person is going to be Jacki.
Yes.
But here's the funny thing. I actually, one practice, they said, we're just bleeding, we feel reimbursement, we just don't feel like, we think there's a leak somewhere. So I said, all right, let me just evaluate your explanation of benefits from your top 4 payers. That I can do. So I went and took a look, and one thing, and this is going to circle back to a question about an MSO role, is that I noticed that, and this is weird, all the female physicians in this practice, and it was a practice of 40, and they had 17 female physicians, the rest were male physicians. their reimbursement for office visits at certain levels was about 9 cents less to about 15 cents less. And I just happened to notice it, and I looked over and I'm like, that's almost on every contract. So then I went through and looked, and they signed a contract to pay their female physicians less, and they didn't even know it.
Oh my gosh.
But the thing is that one of the doctors basically said, of course, not one of the female doctors, who was like, "You kidding me?" They were like, are you serious right now? And they said, and one of the other doctors said, it's only 9 cents. I'm like, oh my gosh.
You're like, that doesn't matter.
I'm like, I don't care if it's a half a cent.
I know.
Why is that doctor, based on gender, why is that doctor worth less than you when you're the same specialty, same education, same? And why do you let the payer do that? So does an MSO kind of also evaluate contracts and at least look to see if they're
Yes.
Okay, that's
Yeah,
great to know.
So now MSOs, I will say, if they're in a state where, they have to keep clear separation between the medical practice, they will not be responsible for the physician compensation, how they allocate that out. However, they will look at the agreement. And that's really where I think it's super imperative to make sure they bring in competent healthcare attorneys on both sides, as well as consultants, because one of my favorite areas to talk about is physician compensation. And I do a lot of physician compensation, fair market values. But that's the biggest thing, is just making sure it's a good time to reevaluate, how are the physicians getting paid? Does it all make sense? And is it fair market value?
Right, especially with the sliding scales of contracts. And
yes,
we just got the fee schedule proposal from Medicare, which shows where they want us to take another 3% cut. And so I guess it would base also on what kind of practice you have. Now, are MSOs, do they have a required specific set or minimum number of services they have to offer?
No.
Okay.
So I will say that it's not. No, the biggest thing is that the fee aligns with what the services are being provided.
Okay.
So that's really what it comes down to, is again, stressing the fair market value of the administrative fees. Because you can't be, for example, just providing one small service and charging an astronomical amount, because that's not gonna pass muster.
No, right. Now, does it make a difference? Well, I know it does, but on what scale, I guess? If you're a single practitioner, do you really need an MSO, or is it more for larger, more populated practices with at least 10 providers or whatever?
So I have seen single practice owners and single practice providers have an MSO help out. And really the key there is the economies of scale. They're able to, really benefit from the contract negotiation perspective, and then also try to keep overhead down because of how expensive it is to run a practice these days. So it's, the MSO might not be in charge of all their functions. For example, staffing, they might not need that help from the MSO, but there are perspectives that the MSO could really help bring for the legal aspect, because they'd be able to help with attorney fees and IT fees and all of that. So the practice doesn't have to have that burden.
It almost sounds like it's a way to have a local, meaning not just necessarily in your backyard, but access to an organization that has your back on administrative services.
Yes, absolutely.
Okay. So then I just a quick question on ACOs, because I know that's not the same thing.
Right.
At all. And a lot of doctors think it is. They look at accountable care organizations and think, oh, well, that's my MCO. I'm like, well, no, what that is that's a little different. That's a bunch of physicians basically kind of getting together. They're trying to reduce healthcare costs, and they call it improving quality throughout by basically collaborative efforts of all these physicians together. But they also get some financial incentives from CMS if they reach certain benchmarks. But what's really the difference there? I would think an ACO still might need an MSO.
Yes. Yeah. So ACOs, they're formed by a group of doctors or hospitals to really just at the core of it, improve healthcare delivery to Medicare patients. So it's still very much the medical side and of services, whereas a management services corporation or MSO is it can be formed also by physicians, but it's to really outsource the business side of their job. So that's at the high level. If you were to look at the two differences, I would say ACO is more, how to streamline care and improve healthcare delivery to patients versus the management side of the function.
Okay, that makes a lot of sense. So just to kind of wrap up this discussion here on MSOs, if somebody was to call you, Jacki, and say, okay, we're considering an MSO, we've been approached by one that wants, us to join, or we'd like to start our own, what would be a couple of questions? The first thing you'd say, here's what you need to do first.
Yeah, the first thing I would ask them is why. What's their I mean, it's
nobody ever knows the answer to that question.
Well, and the thing is, there might be things that are happening within their practice that they just can't manage themselves, and or they can't keep their costs under control, or everybody kind of has their own motivation for why they're interested. And so the first question there would just be, what benefits do you see from this? And if they don't know, that's really where we have a chance to take that proposal from the MSO and really start to dig in to see, under a hypothetical scenario, is it beneficial? Is it actually going to help me out without just them saying, hey, we're here to help you? That only takes it so far.
Right.
So
well, it sounds like it's kind of like a private equity thing that comes to these doctors waving stuff in their face, and it's like, wait, let's do some due diligence research here. Is it something you actually need first, and what is your objective? Why do you want to outsource this, right?
Yeah. And I will say, it's not all MSOs aren't all private equity owned, but every MSO brings its own benefits, and so that's really where you try to make sure that the benefits you're being told you're going to have actually pass the inspection of when you're doing your due diligence.
Now, MSO doesn't lose the physician's autonomy like some private equity does it? It's different, right?
So that's really where there's different types of MSOs where they can buy the practice's tangible assets and manage them directly. So that actually does restrict some autonomy somewhat, but it doesn't go as far as, employing the physicians. But it would be much more difficult for a physician to terminate an agreement with an MSO if they own all their practice assets or own their office, for example, because that's another thing. They can own their facilities and rent it back to the practice. So I would say there's all different types of arrangements, but when it's just business services to the practice, they can remain quite independent of the MSO and choose whether, once the contract agreement or terms come up for re-evaluation, they're able to make decisions based on how it's going.
That makes sense. It's just trying to just kind of get my head around if I was wanting to recommend this to a provider that administratively they just keep hiring, and they're not really getting to where they need to get. I mean, perfect example, a lot of physicians practices hire me to audit. And then I find problems. I find things they're not billing for, or things they shouldn't be billing for, or just it's just sometimes a mess. And I bring them the audit results, and then they kind of put it in a basket, and they don't do any kind of corrective action. And why have the audit? Why put yourself through the expense? And why keep hiring people if you don't have a way to fix it?
Yeah, that's painful. And again, like that's where if they can't get good billers, for example, MSOs can provide billers. So it's just, it's a matter of what the practice needs are and then evaluating what the benefits versus costs are for an MSO.
Okay, so it sounds definitely like a way to alleviate administrative burden in all kinds of different areas for the providers.
Yep, exactly.
Oh, that's awesome. Well, I appreciate you being here today. I can't tell you how informative this was, and I hope to have you again on the podcast.
Thank you so much, Terry. It was fun.
Okay, great. This topic could not come at a better time with the unrest we're seeing financially in healthcare and other industries, so we appreciate Jacki's time and insight with us. To contact Jacki directly, you can go to nschbc.org website, click on the Find the Consultant tab, and type in Jacki, Jacki, in the first name field, or Jacox, Jacox, in the last name field, and you'll have her direct contact information. Also, as a reminder, the nschbc.org website offers monthly free webinars on a variety of topics, as well as quarterly Medicare regulatory updates. Please go to nschbc.org and click on the tab Upcoming Education. That's it for us today, everyone. Make it a great day and a great rest of your month. And thank you for listening to the NSCHBC podcast. I'm Terry Fletcher.
Thank you for listening to the NSCHBC Edge podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.